Repetitive strain injury, or RSI, is a common problem. It happens when you do the same movements over and over again. Another name for RSI is cumulative trauma disorder. This name emphasizes the gradual buildup of damage over time. Imagine a rubber band being stretched repeatedly. Eventually it weakens and might even snap. RSI is like that for your muscles and tendons. Small tears can develop from repeated stress. Your body may not have enough time to heal between these micro-injuries. This leads to pain, stiffness, and weakness in the affected area. Remember, our bodies are designed for a variety of movements. Repeating the same actions constantly can have negative consequences. It's crucial to understand RSI to protect your body and overall well-being. RSI can strike various parts of your body. It often affects areas involved in repetitive tasks. Your hands and wrists are prime targets. Think about typing, writing, or using tools. These actions, done repeatedly, can lead to pain and discomfort. Your elbows are also vulnerable. Tennis elbow and golfer's elbow are classic examples of RSI. These conditions cause pain on the outer or inner side of the elbow. They often result from overuse in sports or certain occupations. The shoulders, neck and back are not immune to RSI either. Poor posture while sitting at a desk all day can contribute to pain in these areas. Remember, RSI isn't limited to athletes or specific professions. Anyone performing repetitive motions is susceptible. RSI can happen to anyone, but some people are more at risk than others. People with certain jobs are more likely to get RSI. This includes office workers, musicians, and construction workers. These jobs often involve repetitive hand movements. Athletes are also susceptible to RSI. The repetitive motions of sports like tennis or swimming can take a toll on the body. Age is another factor. As we age, our tendons and muscles naturally lose some elasticity. This makes them more prone to injury from overuse. It's important to listen to your body. If you feel pain, take a break. Early detection is key to preventing long-term problems. Diagnosing RSI involves a physical exam and understanding your medical history. Your doctor will ask about your symptoms and the activities that might be causing them. They'll assess your range of motion, posture, and any tenderness in the affected area. Sometimes imaging tests like X-rays or ultrasounds are used. These tests help rule out other conditions like fractures or arthritis. Treatment often begins with conservative measures. The RICE method is a good starting point: rest, ice, compression, and elevation. Over-the-counter pain relievers can help manage discomfort. Your doctor might recommend physical therapy to strengthen muscles and improve flexibility. In rare cases, surgery is considered if other treatments fail. Remember, early intervention is key to preventing long-term complications. If you experience persistent pain or discomfort, consult your doctor for proper diagnosis and treatment.